Hi, I'm Douglas Sanderoff. I'm a board-certified plastic surgeon practicing here in New York City, and I'm speaking to you today from my fully accredited outpatient surgical facility located on Park Avenue South in New York City. And this is where I do the majority of my plastic surgery procedures. We've been here for over 15 years performing plastic surgery procedures of the face and body. Today I'd like to speak to you about buttock augmentation using solid silicone implants. Now this is an operation I've been performing for many years, and it's an operation that I'm known for. I have the largest published series of buttock implant procedures, well over 200 in my first publication, and I've done hundreds since. This is an operation I'm very comfortable with, and an operation that leads to very high patient satisfaction. And the way the operation works is we use a solid silicone implant. It's made out of silicone, and I have a sample of it right here. And now this implant can be inserted through an incision in the buttock crease between the two buttock cheeks, so the scar is very light. The implant is then placed either within the muscle or the lining of the muscle to camouflage it and keep it from being very visible. And the idea is to pick an implant that fits the patient's body. And I have two implants here. You can see different sizes. This is a little smaller than this one. This is about 275 cc's. This is 375 cc's. And these are the two ranges of the implants that I like to use. This one has a light texturing on it, and this one is smooth. We're tending to use more smooth implants now. Patients seem to like them a little bit better. So these are the choices that we basically have. Now, when you come to visit me for consultation, the first thing we'll do is we'll determine your goals. What is it that exactly you want to see in your buttock, and we'll take a look at your overall shape. Now, it's not a one-size-fits-all operation. It can be used for patients who are very thin, to patients that are average weight, or even patients that are a little more full-figured. So the implant size is not the same for everyone. Obviously, a very skinny patient is going to need less of an implant. They might not need a 375 cc implant. They might get the same result with a 275 cc implant. So that's why it's important for patients to come in, meet with me, we'll take some measurements, we'll put the different sizes on their buttock and see what it is we can do to help them meet their goals. In some situations, I perform liposuction of the lower back and flanks, and we can use that fat to create a little more width of the buttock and a little more camouflaging of the implant. In addition, the liposuction of the lower back creates a better waistline, so overall a more sculpted look. So when you come to visit me for a consultation, we'll sit down and we'll take a look at photographs of your body, as well as photographs of people that we've done in the past, and we'll see if your expectations can be met. The preparation for the surgery is not a big deal. Basically, you can't have anything to eat or drink the night before the operation or the morning of, and we will provide you with antiseptic cloths to remove the bacterial content of the skin. The morning of the operation, you'll come in wearing loose, comfortable clothing and on an empty stomach. We will use our marking pen to draw out the template of the implant on your buttock, and we will show you where that implant's going to sit. In addition, any areas of liposuction will be pointed out as well. And then we'll start the operation right here in this very room where the surgery will be performed. After the implants are placed, you'll be in the recovery room for about an hour and a half in compression shorts, and then you'll be able to go home. We like patients to maintain themselves in a prone position. That means lying on your stomach for several days as much as possible to take any pressure off the buttock. And after about a week or so, you'll feel pretty much back to normal. After 2 to 3 weeks, you'll be able to engage in regular activities again, although I like patients to refrain from intense physical activity for at least 1 month. I'll be monitoring your progress along the way and making sure that you heal very well. So if you're interested in this procedure and you want to learn more about it, I'd be very happy to meet with you. You give a call to the office and come in for a visit, and we'll see how I can make you happy.